In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Half a day, everyone, and welcome to another edition of In Full Zoom. I'm Nestor Licanto, and I'm pleased to welcome our guest for this week. He is Dr. Arturo De La Pena, who is the president and CEO of St. Luke's Medical Center at Bonifacio Global City. I'm sure quite a few of you have been there. Doc, welcome back to Guam. Nice to see you.
Good afternoon, Nestor, and good afternoon to all of those watching your show.
Thank you. And first of all, let's talk about what everybody's been talking about for the last year and a half, the COVID pandemic. How is it going in the Philippines, first of all? And how is St. Luke's Medical Center adjusting?
Well, we did a lot of adjustments during the last year from March to December 2020. And as of now, as we talk now, we're almost 95% back to the normal of the pre-COVID days in our operations. The number of cases of COVID patients being admitted into the hospital, there were two surges. One was on August last year, and then there was another surge last March. And so far, when the vaccination program has been started, especially for the National Capital Region, this was associated or accompanied by the reduction in the number of COVID cases being admitted into the hospital. As of now, it has decreased by about 60%. Only about 30% as compared to last year's admission are now presently admitted in both Global City as well as Quezon City. So it's the net effect of the vaccination program. So as a matter of fact, for the Philippines, before the year ends, we have a lot of vaccines coming in, especially up to the end of July, and mostly in the entire month of August. And when we institute the vaccination programs, when all of these vaccines come in, by our estimate, by late November or early December, we might be able to vaccinate about 60% of the general population. So we're nearing being able to get or attain hormonal immunity, herd immunity in the country. And hopefully that will check on the transmission of the COVID infection in the country.
That's good news. Good to hear.
Yes.
How specifically has St. Luke's had to adapt? Your frontline personnel, what sort of protections, and patients that you see, what sort of protections?
Yes. Since last March, when we volunteered to be vaccinated because there were very few takers from the very beginning in the country. So we volunteered and we were able to vaccinate about, as of now, 98 to 99% of the entire staff of both hospitals. The numbers about almost 10,000 associates, 6,000 in Quezon City and 4,000 in Global City, have received 2 doses of varying types of vaccines. It ranges from Sinovac, AstraZeneca. Lately, we're giving Pfizer. Soon, we're going to give Moderna and J&J because the Philippines is part of the world study on J&J vaccines. So hopefully, before the end of July, almost 100%. But even then, we are fully vaccinated. Let me share you the information that we got. After the first dose, about only 5% of our employees got the COVID infection. And almost all of them are mild to moderate. About 5 associates got admitted and they recovered all from the COVID infections. After the second dose, out of almost 10,000 who had been vaccinated, about 1.5% did develop COVID infection. All of them were mild and they did not require any hospitalization at all. They just quarantined in their houses, and after about 7 to 10 days, they went back to work. So that's how I think is the net effect of the vaccination program that we have instituted at St. Luke's. But in spite of that, we are still very strict because of the emergence of the Delta variant. There had been documented transmission in the country of the Delta variant, although not that much. And I think the quarantine strategies of the government is working well. We run out of the alphabet in naming what types of quarantine we're going to give, depending on the surge or clustering of cases in some parts of the some parts of the country. So I think sticking to all of the health protocols, instituting vaccines, I think we might be able to check on the further transmission of the disease.
Yeah, Doc, you're here in Guam for a semi-regular trip, and I think you met with some of the local health insurers. What can you tell us about your purpose for your trip here?
Yes. You see, when the pandemic set in, there's a lot of requirements in terms of quarantining patients coming from overseas. It started then, for those who were not vaccinated, 2 weeks quarantine whenever you reach the airport or the port of entries on the ports.
In Full Zoom, we'll be right back.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
What do you call this? The vessels, sea vessels that are coming into the country. Now, they have changed, and we have adopted that for those who had been vaccinated, and once the vaccination had been verified by our country, they will still undergo quarantine for 7 days. So there's still a lot of discomfort for patients going to Guam, especially those who are really afflicted with acute illnesses. So we propose to the government, and that the agency that handles this is the Interagency Task Force, composed of the Office of the President, the Department of National Defense, the Department of Health, DTI, or Trade and Industry, and Tourism, and other support facilities. We propose a medical bubble program for patients coming from Guam and the Asia Pacific Islands. And the specific is that if you are vaccinated, and we prepare patients to be vaccinated because I understand you're almost 70% vaccinated as we speak, as we talk. So if you come to the Philippines, we are going to facilitate your entry into the country. Of course, there will be some requirements that will be required for patients. And when they reach the airport, they will not be quarantined. We are going to, and with all of those supporting papers that have been approved by IATF, they are going to be fetched by our courier service. They will be brought to the hospital together with their accompanying person. The accompanying person will be billeted in our hospital hotel, free of charge. And those patients would undergo consultations, executive checkup, or will undergo certain procedures. They will be admitted directly into the hospital. Of course, preliminarily, we're going to do the swab. And if the procedures are done less than 7 days, we're going to bring back all of these Guam patients and their companions to the airport and send them back to Guam. We have made arrangements with the governor of Guam, and once it follows the point-to-point bubble medical treatment, they will not undergo quarantine requirements when they come back to Guam. Now, if there will be an extension of 7 days, you have completed your quarantine, some people can get out of the hospital. They can go somewhere. But during the time, but before 7 days, then we will provide assistance for their shopping requirements. So that will be the medical bubble treatment that had been approved by IITF. The main reason why we came in here was we have informed the government of Guam that it has been approved. We have talked to the consular office, the General Consul of the Philippines to Guam, Mr. Hilado. The Consul General is Mr. Hilado. Because if patients coming from Guam are not holder of Philippine passports, one of the requirements is they will be given by the consular office a medical visa, which will take a long time using the routine process. With this, it can be facilitated so that within a few days, those patients who will be going to the Philippines will coordinate with PhilMD through Annette, who is my boss here in PhilMD. He will facilitate all of these travel arrangements. And once they come to the Philippines, our counterpart there will be going to fetch these patients and bring them to the hospital without any hassle at all. So this is a pilot test. Our trip in here, we followed the step-by-step, and then going back, we will test whether this will work. And I have no doubt that this will work.
More in full Zoom right after this break.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
Yeah, I think this is going to come to welcome news because literally hundreds of Guamanians would pre-pandemic would travel to Manila every month for specialized medical services at St. Luke's. So you anticipate you're going to be able to service several hundred a month, or what's your outlook?
Well, it will have to depend upon the capacity of the flight that will be flying over to Guam. But should the volume will hit probably a critical number, we are looking into the possibility of charting a flight. We're going to have a chartered flight. We're going to talk with some of the airlines in the Philippines who might be willing to undergo a chartered flight from Guam to Manila and back. It all depends upon the volume.
Is there a pretty big backlog of patients that have been continuously being seen at St. Luke's that need to keep coming back?
Yes.
And give us an idea of what that's been like.
Well, when the pandemic came in, starting March last year, all of the checkup, all of the laboratory tests of most of the patients, especially local patients, were neglected because there's difficulty of access to the hospital. So what happened? From April to about November, December, we're getting about 5 to 6 calls of heart attack at the emergency room, and about 4 to 5 calls of stroke at the emergency room, because their well-being were neglected during the time of the pandemic because of quarantine restrictions. Also, many cancer patients became worse in stage because they're either afraid of going back to the hospital, or the access to the hospital are not available for everybody, especially living outside Metro Manila. So that's the situation, and that's the reason why starting June, we initiated measures to entice and assure patients going to St. Luke's that it is safe to go to the hospital, because the facilities handling COVID patients are separate from those handling non-COVID patients. Infrastructurally, The global city was designed to do so. Even the elevators are different, the machines being utilized for COVID patients are different, the personnel are different, and the rooms are different. So we were able to segregate. And our tagline then was, the safest place to go during those times is the hospital, because everybody follows all of the health protocols. When you enter into the hospital, everybody should declare a health declaration. They will be checked with regards to their symptoms. Their temperature will be checked. We're very strict about it. Everybody wears masks and even face shield, because Philippines is the only country that adopted utilizing face shield as a requirement, and physical distancing. That's why we hired people who would man the elevator so that we can control the movement of patients going up and down the hospital. And with that, we were able, no patients who ever admitted for non-COVID patients developed COVID while they were being admitted into the hospital.
Yeah.
So, yeah.
So if a patient here had been waiting to go to St. Luke's and now this opportunity arises, how do they go about? Do they need to go to their doctor, their health insurance company to get a referral, or how does that work?
Yes. They should get a referral, and then they bring them to PhilMD, who will check on all of the requirements. And once that is checked, it is going to be sent to us. We'll get all of the approval papers and accompanying papers back to Guam, so that when they travel from Guam to Manila, they have all of those documents, so that once they reach the immigration, they will have a smooth transition or getting out of the airport and be brought to the hospital immediately.
Yeah. Can you give us an idea of what sort of documentation will likely be necessary?
Well, I think it's going to be the referral coming from the health provider, there's a referral from the doctor, because it will shorten what is going to be done, because we're going to plan what they're going to be done once they come to the hospital. We have to be very efficient in doing so. And if we know what they are suffering from or what they need, we can make what do you call this? A pathway for them to be able to go from one place to the other seamlessly without any delay. Second is they have to get the approval also of their insurance companies. And I think that's the one. And the other one is, if you are not a passport holder of the Philippines, the only requirement will be a medical visa being granted by the consular office of the Philippines here in Guam, which Annette also will try to facilitate in getting that medical visa. We have talked to yesterday, we talked to the Consul General, Mr. Hilado, and we get the assurance. Once we get back to Manila, we're going to talk to the IITF so that there would be just an advice from IITF that if the requirements of patients coming from Guam are completed, the consular office in here will be given the authority immediately to grant medical visa to these types of patients. So that once that is accomplished, Annette can plan or book for their flight and together coordinate what should be done when they get into the hospital.
And is this for any kind of treatment at the hospital, or are there specific treatments only that will be allowed?
No, everything. It will cover from consultations, from checkups, from executive checkups, and then actual treatment of active diseases.
Okay,
that covers for everybody. Yes.
Yeah, so it's pretty much wide open. What are the most common services that Guamanians travel to Manila and to St. Luke's to avail of?
Majority are for executive checkup and for continuous consultations for the treatment that I have received previously, specifically for cardiovascular diseases and cancer cases.
Yeah.
So, and then some other rare conditions that cannot be handled here in Guam, we usually take care or take charge of taking care of these patients once they get to the Philippines.
We're going to take a short break and be back with more In Full Zoom. Don't go away.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
I remember the last time we spoke, you mentioned about different new services, specialized services that the St. Luke's was offering. Is there anything new? What are the latest? You continually upgrading your services there.
Yes. As you all know, and probably known to everybody, St. Luke's is better equipped as compared to 95% of the hospitals in the US. We are now offering minimally invasive procedures. The traditional operations of opening cavities of the body, they are being entered by making small incisions into the chest or abdomen and handle the main problems, whatever problems inside those cavities. We are now the #1 hospital in Southeast Asia in terms of rate of the development of robotic surgery. And we are strong in minimally invasive treatment for cardiovascular diseases. We can replace bulbs without opening up the chest.
Wow.
And yes, and also for aneurysms, they are not being operated anymore. We can institute stents over the aorta of the body, which before they should be opened up, and those were challenging operations. So it has become simpler already. And in terms of cancer cases, we have been introducing a lot of new modalities of treatment, especially the immunotherapy or targeted therapy. Whatever is available in the mainland US or some other countries, if it is available, we usually get them as soon as possible. So we can offer that also to any patients who will seek services in our hospital.
And I remember talking to you one time about, you're talking a little bit about robotic surgery or services. Yeah.
Yes. Robotic surgery. Together with me is Dr. Dennis Serrano, who has done the most number of robotic prostatectomy, removal of the prostate if they're afflicted with cancer. Because one of the complications of doing open surgery is the injured responsible for erection. So a lot of patients develop erectile dysfunction. With the robot, they can do the surgery and preserve all of those vital structures without opening the belly, and the recovery is faster. Before, they stay in the hospital for about 7, 8, up to 10 days. Now in 3 to 4 days, they can be sent home.
Yeah.
Because the recovery is faster. Yeah.
Most of the folks on Guam, I think, are more familiar with the St. Luke's Medical Center at Bonifacio Global City. Very nice facility. But actually, the original St. Luke's is in Quezon City, and I know that you're in the process, have been in the process of upgrading. Can you tell us a little bit about that?
Yes. We call it as the Quezon City Redevelopment Program. It has started first week of July. And we started with the multiple level parking, and we're going to transfer at the ground level of that multi-level parking, outpatient surgery and dialysis center. And then we're going to put up a pivot building so that all the areas, because being an old hospital, there's a lot of challenges in terms of the movement of patients requiring different procedures, not seamless, because the addition of the facilities were not thought of very well. So we're going to address that, because we're going to build a new building at the back of the hospital that will house all diagnostic equipment and all of the operating room and all of the ICUs, as well as other critical care units. And all of the surgical rooms will be placed on that building. and the vacated place in the old hospital will be redeveloped and converted into patient areas so that patients will have more freedom and more ease in movement, because as of now, very difficult. If you are familiar with the emergency room there, the emergency room there is very, very small. We're going to convert when the Quezon City development program is completed. The emergency room will be one probably the biggest among the hospitals here in the Philippines.
Yeah.
So
And
it will be better services.
Yeah, and once that's completed, when will that be? And will Guam patients be able to go there as well?
Yes, even now, there are some patients coming from Marshall Islands and Palau. They prefer to go to Quezon City because they used to go to Quezon City and they're familiar with the setup there. But it would soon, in about 2 years, it will change dramatically. We're going,
okay, Doc.
Yes.
Go ahead, I'm sorry.
We're going fast-tracking the redevelopment program. Yes.
Okay, we've got a couple of minutes left. I just wanted to ask you to ask our viewers here your final message. What do you want to tell them?
Yeah, thank you, Nestor, for this opportunity to all our patients in Guam who had used to seek treatment and consultation for St. Luke's, Quezon City and Global City. We have now developed a medical treatment bubble system, point to point. It has been approved by the government. We are now pilot testing how it's going to be implemented. And as soon as we come back to the Philippines the following day, the only hints will be getting the medical visa for patients who are not holders of Philippine passport. We are going to ask IITF to issue an order once all of the documents are completed, an order to the consular office here in Guam to issue medical visa at the earliest possible time, so that once all of these are completed, PhilMD will be able to coordinate or start making preparations for their trip to the Philippines that would not require any quarantine procedures, the usual at the port of entry. They will stay in the hospital, and as I have said before, accompanying patients for admission will stay in the hospital for a period of 7 days. And our preference is all of those patients, as well as companions or patients, should be well vaccinated, so that that will be easier, because there will be a lot of questions if the patients are not fully vaccinated. But if these patients, even though they're not vaccinated, if they're suffering from illnesses that would require immediate treatment, they can still pull some strings to be able to accommodate them as soon as possible.
All right, thank you, Doc.
Yes.
Sorry, go ahead.
And so just wait in the next, hopefully by the end of this week or by the start of August, this program will be fully implemented. So we're looking forward to meet you right there at the lobby of St. Luke's Global City in Quezon City. If I have time, I will make time to be able to meet you once you get to the hospital.
There you have it. I
Don't
think
worry.
this is very welcome news from all of your many patients. Looking forward to going back to St. Luke's and getting some treatment. Thank you so much. Dr.
Thank you,
Arturo
Nestor.
De La Pena is the president and CEO of St. Luke's Medical Center in Manila, Philippines. He is our guest this week. Thank you so much, Doc. Take care.
Thank you. The pleasure is ours. Thank you.
All right. And I'm Nestor Licanto. Thanks for watching, everyone. We'll see you again next week on In Full Zoom.
Bye.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.